Hi and welcome to Healthy Living. I'm Dr. Debbie Lanes. I am here today with Dr. Stephen Luther. Thank you so much for joining us.
My pleasure.
I feel like I have known you for many years, and one of the things that I know about you is that you are health, wellness, and prevention, and I so admire that, and it's only perfect that we're out here in nature today because that's a big component piece of this. But I'm excited to talk today. It's been an interesting time for all of us. And poor Dr. Luther asked me one question, and 20 minutes later we had to start the show. But I think it's a different time for all of us now. Share with us a little bit about not just your philosophy, but how your practice of medicine during this change. It's a medicine at a crossroads.
That's a good point, Debbie, and I think when we have a crisis like this that comes along, it oftentimes reveals a lot of things about us as a society. And as individuals too, and as we were talking, the things that we have learned from this as individuals that we have gone back to that are important. But from a medical perspective, one of the things that I've been struck with in our country, unfortunately, we are overwhelmed with chronic disease. In fact, there was a national health study put out that showed that only 12.2% of our population was at ideal metabolic health.
Interesting. Talk to me, metabolic health as defined as?
Metabolic health talks about things that lead to chronic disease, and the biggest thing right now is insulin resistance, and that usually comes from inactivity, lack of exercise, and an overabundance of refined carbohydrates, things such as cereal, oatmeal, pretzels, crackers, chips, bread, rolls, all the things that are easy to grab, and sugar is probably the greatest culprit of all of those things. Things like cookies, cakes, pies, candy, ice cream. The things that we all love to enjoy, but when we eat those things, that causes our body's insulin level, for those of us who have insulin, most of us do, to rise. And insulin is the #1 fat storing hormone. So more carbs mean more insulin, more fat, and that's very inflammatory.
Fat
and
inflammatory.
So, yes, so eating fat won't make you fat, but eating sugar will. And good healthy fats don't stimulate that insulin level. But when the insulin level goes up and you start to go into that process, you start to see the metabolic syndrome. Blood sugars rise, triglycerides go, central obesity, exactly, diabetes, high blood pressure, heart disease. Alzheimer's is even now being referred to as diabetes of the brain.
Interesting.
And many metabolic cancers. But when you look at some of the studies with this COVID-19, which is the hot topic of the day, the people that are struggling the most with this are those with metabolic disease. They're the ones that are being hospitalized. The elderly people are the ones that are not making it through this as much. And so when you start to see that, we are ill prepared to deal with a crisis like this.
So talk to me about just a layperson. What are some things that we can do, I guess, personally as a community, and then really more or less globally, to be more healthy? What do you recommend as a first line of defense?
Well, I think you got to start with the truth, and you have to start looking at what
that darn truth. Huh?
Yeah, it is, and that's very, very hard to find, I will be honest with you. And there's a lot of studies and there's a lot of voices out there, but really trying to understand the truth, and taking a look at behaviors that lead to a healthy lifestyle. And after almost 30 years of practice and hundreds of thousands of dollars of education, I counted out over 100,000 hours of practice and education. It comes down to a simple truth that I've heard said before, just simply getting off the couch and getting off the carbs. Those two simple behaviors will probably do more to help prevent chronic disease in our society. And right now, as you look at what's going on around us, one thing that we're going to find out, and this is right up your alley, anxiety and fear have a 3.5% mortality rate in some of the studies by the National Institute of Health. And we behave the way we behave because we believe what we believe.
Exactly.
And fear is one of the #1 human motivators. So if you can take a look at your behaviors and why you're doing them, you can start to understand where this is going and then where that leads.
It's really interesting. I do with all my patients, I do this HALT. Are you hungry, angry, lonely, tired? Right? And normally, we're all of those, right? Yeah, I'm a little hungry, or I'm tired, or somebody's bugging me today. And I think that's like the #1 easy stress reliever, kind of down and dirty thing. If you're hungry, go eat something healthy. How do you recommend, from a dietary point of view, what do you like to see your folks do? Because basically, Dr. Luther, what I hear you say is lifestyle. makes?
Well, there's a difference between lifestyle and behavior. Lifestyle is how
Okay.
many boats, cars, where you're going to vacation, and things like that. So this is not a lifestyle issue. This is a behavioral issue,
Okay.
and it transcends all lifestyles. And so it's how you behave. And so, there's a lot of different opinions right there on diets right now. But personally, meat, vegetables, nuts, seeds, some fruit, the berry fruits, the raspberries, blueberries, blackberries, strawberries, those are low glycemic, low sugar fruits.
Okay.
So meat, vegetables, nuts, seeds, some fruit, little starch, and no sugar. And that's a very good recipe for a very healthy life.
Is there something to be said about 3 meals a day, 5 meals a day, big meals, small meals, when you eat? I mean, because I guess for me, when I say lifestyle, I don't really believe in diets. I
Right.
believe in eating consistently and healthy all the time.
Right.
80-20 rule for me.
Right, and so I think we all consume nutrients in a different fashion,
Okay.
and I think trying to choose the most nutrient-dense, healthy whole foods is probably a really good place to start. And whether you are a multiple eater throughout the day, whether you're an intermittent faster where you only eat for 6 to 8 hours of the day, whether you're more of a keto person or paleo or more of a vegetarian person, just trying to find that happy spot for yourself and what works well for you. But it does take, I'd say, I guess the principle is if you don't know what's going in your body, nobody else on the planet does. And so if you really want to study your nutrition plan, you really have to weigh it, measure it, and record it.
Okay.
If you aim at nothing, you're sure to hit it. Okay?
No.
So if you don't know what you're doing and you aren't weighing, measuring, recording, then you're just sort of guessing. And everybody has a pretty good diet, and everybody
Yeah.
thinks that they're not eating this, that, and the other until they actually start looking at it.
Let me ask you a question about your practice specifically. Who is your demographic? How often should someone come in and see their physician? When should we come in? And one of the things I've noticed in this time is I have a 92-year-old dad who lives with me, and he's like, should I go to the doctor? Should I not go to the doctor? It was my sister's physical. Should I go to the doctor? Should I not go to the doctor? What's your counsel for things like that?
My demographic is certainly the demographic of the island and the whole area, which is probably more of a retired demographic by far. My dream patient would be somebody that would come once a year. We'd set up a health plan and implement it.
Right.
But the reality of that is I have very little power to change behavior. In 28 years of practice, I can give you a lot of truth, I can give you a lot of advice, but the number one thing I cannot do is change your behavior, change the will of a human being. That has to come from within. So some people want to be touched more, and so maybe it's once, twice, 3 times a year to try to get that flame going. Exactly.
Yep.
If they're engaged in other activities that are healthy and promoting their health, like going to a healthcare facility, a gym, a fitness center, maybe they're being touched 3, 4, 5 times a week there by people that are like-minded, and that can help too. So, I think that everybody's different in that regards, and a lot of the things that we'll do are based on crisis needs. They get sick, and maybe they need a visit, and so we accommodate that.
But in a perfect world, it would be more of a prevention kind of thing. It would be setting some goals. Are you more the advocate and sort of the, you're the professional, but also the advocate of my health, sort of the cheerleader, if you will, if I'm doing well, and the coach if I need to improve?
I think that's a good thing. I think it's your life and your body, and my goal every day is to fiercely pray for truth and provide that for you that would be applicable to you. I had a wonderful program director, and he was a cardiologist, and he said, give everybody a chance to be normal. Everybody a chance to be normal. That means give everybody a chance to be healthy coming in. And unfortunately, the medical profession, and I found that to be true one day. I just woke up and I said, dang, I'm a pretty negative guy. All I do is look for problems all day long in people and tell them what their problems are. But if we start with a more holistic approach and focusing on health, fitness, and longevity, and what's important to you, what are your goals, what are your priorities for life, and then how can I help you live those? That's
pretty impressive.
kind of what we want to be about.
I mean, that's the whole name of the game. Do you feel like your practice has evolved in the time that you've been a physician?
It really has. It really has. A few years ago I had high blood pressure, cholesterol, and I was overweight. And I was just going through normal routines and exercise, and I woke up one day and just said, I got to change myself. And I called a buddy who had a fitness facility, and I told him my problems, and he said, show up. So my wife and I showed up. We had some introductory class, and within 3 months, I was off of all medicines. My body weight was going back down. My body fat was down. And I've never looked back. And then I had an opportunity to invest in that facility, and it's really become an offshoot of my practice. And the large organization that we're a part of has really struck out to try to focus on preventive health and really kind of expose some of the ills of, and that's another thing too that I realize in long-term of practice. I have so much power to prescribe medications, but very rarely does that make you healthier. The pill just makes your numbers look better, but it does not make you healthier.
Homeostasis, right?
Yeah.
Exactly. We're going to take a quick break and come back. I'd love to talk a little bit about telemedicine.
Okay.
I'd also like to continue on this path because I think it's absolutely fascinating. Stay with us. We'll be right back here on Healthy Living.